Thank you all for attending this Major to Career panel that's hosted by the Center for Career and Experiential Education. So thank you for also hosting this, Kristen. My name is Kim Kness, and I'm an associate teaching professor here at URI, and I am filling in for Sarah Larson today. Before we start, I do want to ask that Kirsten will take attendance for at least for the Nutrition 110 class. And just a reminder, I've been asked to remind you all that your Major to Career panel assignment and reflection is due next week on the 14th. So just a reminder to make sure you turn that in. This will be recorded, and Kristen will be here monitoring the chat room. So if you have questions as we go along, please enter those questions into the chat room. I've got a list of questions that I'll ask our panelists to share, but if we have questions in the chat room, we're happy to kind of include those throughout the program instead of just leaving them all until the end. So I'd like to start by asking the panelists to please introduce yourself and your current position title and how long you've been in that position.
Does it matter where we start?
Who wants to start? No, who wants to jump in? It doesn't matter.
Okay. I'm Kyla Shea, and I'm a dietitian at a private practice right now. So my title is just registered dietitian.
And how long have you been there?
I actually just started in November, so it's
Okay,
been about
great.
5 or 6 months. Yeah.
My name is Nicolette Freza. I own a private practice called Nicolette Freza Nutrition. It is my 5th year of doing that.
I could go next. Megan Sheridan. I am the program administrator for the Diabetes and Cardiovascular Health Program at the Rhode Island Department of Health. I've been in my position since, I've been at RIDO since 2017, but I've been in my position since the onset of the pandemic in 2020.
Hi everyone, I'm Jackie Potvin. I am at the same private practice that Kyla's at. I just started here not too long ago, about a month ago, so I'm very happy to be here. And then previously I worked at Salve Regina as their campus dietitian, and then I've also worked in community settings as well.
Thank you. Well, really excited to have all of you here today and to see you again. Can you tell us about your career journey now that we know where you're at right now? But since graduating from URI, what position you started in? Some of you said you've just been in a job very recently. So where did you start? And then how did you enter into the role that you're at now? So just a little bit about your journey to where you're at.
Yeah. So I don't know if we want to go in the same order. I can start. So I graduated from URI in 2021, and I was a little unsure which route I wanted to go at the time. You could say I was kind of unsure about everything. And so I decided to pursue my master's first. And so I went to Johnson & Wales and I got my master's in food innovation and technology. So it's a little more of like a food systems approach rather than clinical nutrition. I wasn't sure if I wanted to go more the food systems, more research route, or kind of go the internship, more clinical route. And so I figured get my master's first because the requirement was coming up to have that. And then it would give me a little more time to decide which direction I wanted to go in. And when I was in grad school, I fell in love with the food systems, food access side of things. And so I worked at the Johnny Cake Center for about a year and a half in Peacedale. And I managed their food pantry and did more community nutrition education classes. And I loved it. But at the time, I felt like if I had my RD credential, I would have been able to do a lot more in that setting and potentially work more one-on-one with that population. And so I decided to go back and complete my internship. And so I did the Delicious Living Nutrition internship out in Cape Cod. And they have a concentration in sustainable food systems and agriculture, which was definitely my kind of niche area of focus. And so I did that, just finished that this past September, and then got a job at Evolution Nutrition, which is the private practice I'm at now. And I still have my food systems, food access, agriculture passions outside of this that I kind of keep alive by connecting with local farms and volunteering with nonprofits and such. But my job now is more private practice, outpatient counseling.
Great, thank you. It sounds like that experience, you really can bring a lot to your new position now as well.
Yeah, I hope so.
Okay, who wants to go next?
I can go. So after graduating, I started in a clinical position in a hospital before I actually took my RD exam. So it was very dependent that I passed that to keep my job, but I did. And so I worked in clinical for 10 years in various hospitals in Rhode Island and Massachusetts. And I did really love the knowledge that I gained from working clinical. I liked the fast pace. I liked patient interaction. I liked how it was kind of like putting puzzle pieces together to figure out what was going on with patients. But after 10 years, in that time span, I had two children, and like it was just taking a lot out of me, emotionally, mentally, going to the hospital. And I felt like it was becoming for me more and more sitting on a computer and logging notes and less patient interaction. And I really liked the patient interaction part of it, which is where I started to dive into a private practice a little bit more. On the side, I should know, I did work in several private practices as well while I worked at the hospital. So I started working like just very part-time at a few different private practices to see how I felt about that, how they ran their business, if I liked it. And eventually I decided to just I started my practice. I started seeing patients on the side while I still worked at the hospital. And I did that for about a year and then decided I really liked having my own practice and kind of just jumped into that. And for 4 years, I was a cash pay private practice. So I was intimidated. Really, I was intimidated by insurance and thought that it would just be easier to take um, private pay. And for a while, it worked really well. I used social media. Um, and then I just got really burnt out with social media. I'm not a big social media person. It was taking way too much of my energy to do that. So about a year ago, I switched over to taking insurance, and it's honestly been like the best experience for me. Which I feel like a lot of people, that was another reason it took so long to do it. You hear a lot of bad things about taking insurance. And for me, it just aligns with my values of making nutrition accessible to people and like not having that barrier of only being able to provide nutrition to people that can afford it.
Thank you, Nicolette. And
Okay.
that's actually great to hear some positives about the insurance because I think you make some great points there. And a lot of times people are intimidated when they first get started to try to go through the insurance. So that was wonderful to hear. Thank you.
You're welcome.
Okay. Um, who's next? Megan?
Yeah, I can go next. My story is kind of similar to Kyla's. I felt like a lot of my experience through my master's degree at URI and even as a part of my dietetic internship, I really sought opportunities that put me in the community when it came to nutrition and food access work. So my master's thesis focused on early childhood feeding practices. So analyzing the feeding practices of childcare teachers and how they shape children's eating behaviors. And then my dietetic internship, which was part of South Coast, Sodexo South Coast dietetic internship, they offered a leadership concentration. So kind of expanding beyond peer influence of nutrition and feeding and eating behavior practices. I extended my rotations with SNAP Education. I created a rotation with Rhode Island's first director of food strategy, Sue Anderbois. She was tasked with creating the state's first food strategy, which is now called Relish Roti. And I also saw opportunities working for the Rhode Island Department of Health as a public health scholar, mainly for the Wise Woman program, which is a CDC funded program that provides cardiovascular disease risk assessment referrals and support for lifestyle behavior change among women who are eligible. So low incomes, uninsured, underinsured between the ages of 35 to 64. And I really liked working not just in community settings, but in public health in particular. I liked working on public health programs. I liked exposure to grants and grant writing and budgeting. So in 2017, I started working at the Rhode Island Department of Health as the Health Systems Transformation Manager for the Diabetes and Cardiovascular Health Program, which at the time was the Diabetes, Heart Disease, and Stroke Program. So straight from my dietetic internship, I started working at the Rhode Island Department of Health as the Health Systems Transformation Manager. Health Systems Intervention Manager. It's now called the Health Systems Transformation Manager. And so in that role, health systems interventions are really processes that improve and increase quality management and preventive services like prediabetes screening within a clinical environment and help people connect and help to connect people to available programs and services. So yeah, I worked for the diabetes and cardiovascular health program since I started at Rido, and now I'm the program administrator.
Thank you. Jacqueline, do you want to go next?
Yeah, so my journey has been a long one, lots of time at URI. So I got my bachelor's degree in nutrition at URI in 2018. And that was just the nutrition track. I didn't do dietetics. So then after that, I took a little bit of time off, went home, and then I came back for my master's. And again, I did the 2-year master's with the thesis program. I didn't do the internship program. So I did my 2 years master's with Dr. Sarah Amin, who was a great mentor, and loved that so much that I wanted to stay on for my PhD. So I graduated with my PhD just last May. And during the time of my PhD, I was working really closely with a grant out of the Community Nutrition Education Office in Providence. And I really loved that work. Community is still where I consider my home, and I love nutrition education. But during that time, I thought I really wanted to complete my internship to become a registered dietitian because I hadn't really wanted to do it in the past, and now I was in a position where I was doing my PhD. I could kind of get it paid for because I had a great assistantship teaching, so that was a big plus for me, and it was able to just fit into my schedule a little bit better. It was difficult to do all at the same time as my PhD, but it was doable. So I did that. And then when I graduated, I still worked out of the nutrition education office in Providence for a little bit over the summer. Then I got a job at Salve Regina as their campus dietitian, which was food service with a little bit of counseling, mostly working with students who had allergies. And I also taught a course there as well, just a nutrition course. And then I came here to this job at Evolution, which I've been at for about a month. And I really like because I'm able to take what I learned from working in the community with nutrition education and food access and all of that, and use those skills to work one-on-one with people instead of in like a larger group setting. And I really like it here so far. I also teach some courses on the side, just general nutrition classes for different schools, URI, Salve, here and there, which I really enjoy as well. So I didn't have a traditional path by any means, but it worked out for me, and I still love being able to use my degrees for teaching, and then also getting this credential for the diet as a dietitian so that I can do counseling as well.
Thank you very much. Those were all so interesting. And, you can see how things can change even from when you first start at a position that you're not necessarily in that same position forever. So, how things evolve and decisions are made. Another question before I go to the chat, kind of along the same lines, but you've all shared a lot of what you've done since you started working to get to your current position now. But how did you, thinking back to when you were in school, how did you figure out what career path you wanted to pursue, like thinking back to that initial job, were there any internships, small ones in the summer or courses or just other experiences that you had that were really instrumental in helping to make that process? I think sometimes students start and they're like, I really have no idea which way do I want to go. And you all had a little bit of a direction, even if it changed a little bit. So thinking back, to when you were in school, what do you think helped make those decisions? Do you want to go back to Kyla?
Yeah, I can start. I kind of made me laugh when you were asking that because I think back to my senior year and I was like, I have no idea. Like, I don't know what I want to do. I don't know where I want to go. So like if you're in that position and you feel like, I think that's why this career path is so great, is because there are so many options, but at times that can feel a little bit overwhelming as well, and kind of like, what's my next step? What direction do I want to take? For me, I think anything that interests you, just trying it out is the best way to go, because you never know what you're going to like or not like until you try it. And if you don't like it, that's great information to have too. That's just as important as figuring out what you do like. So even if something doesn't have an internship available or doesn't have something marketed, I found that like if I saw a dietitian who was doing what I thought I wanted to do, just reaching out and being like, hey, do you need an intern, even if it's for an hour a week? Can I shadow you? Can I help with like your social media, something, just so that you can get a glimpse of what their life is like. And then once you're inside of that, you can see, is this something like what I thought it would be like? Do I still feel as interested after seeing what the behind the scenes looks like? Every step of like what has gotten me to where I am now has not been what I thought it would be. And like the jobs that I've worked, the internships that I've done, if you had asked me my senior year of college if they were what I thought it was going to be, or like the path it was going to take me on, it's definitely not what I thought it would be, but it's been great and I'm so happy with where I'm at. So I think just being open to any opportunity that comes your way and looking at things as an opportunity to like take a step in the direction, whichever direction it is, was what has made the difference for me. And I still, even now being in this job position, like volunteer opportunities, things outside of work, I still am very open to. I don't know what path my career trajectory will take, but I'm open to learning and kind of meeting people, and you can always get something out of any opportunity. So I think just being open and following your interests and then kind of taking it from there is what helped me.
Great advice. Always being open is never a bad thing. Learning a lot. Who wants to go next?
I can go next.
You think-
Yeah, well, just because what I have to say kind of piggybacks off of Kyla. Like I think being open and willingness to volunteer and to seek opportunities and interests that or opportunities and projects that interest you, but also for me, it was just a matter of taking my time, I think. When I was graduating from URI with my bachelor's, I double majored. So I have a Bachelor of Science in Nutrition and Dietetics, and I also have a Bachelor of Arts in Biology. And that was just because I started off on a biology track thinking I wanted to become a physician's assistant, and then stumbled across the dietetics track. And I just took my time and decided to take an extra year to double major rather than completely switch tracks completely. So taking that 5th year to complete the 2 degrees that I wanted, and then also when I was wrapping up my dietetics program, I just felt like I still wasn't quite ready for my dietetic internship. I wasn't sure what I wanted within the field of dietetics. Again, to Kyla's point, that's what's so great about becoming a dietitian. There are so many different concentrations or focuses that you can have. So I stayed on for my master's degree, really loved community nutrition. So by the time I was going into my dietetic internship, I had a general sense of what I wanted out of my career as an RD. And so I was able to tailor my concentration in my rotations around what interested me, and where I wanted to be, long-term within my career. So.
Thank you. Thank you for sharing. And that brings a good point that sometimes taking an extra year, if you want to double major, it's not in the whole scheme of the rest of your life, it's not that much longer.
Right.
For students that feel that you want to do that, and it can have a lot of rewards later on.
Mhm.
Oh, great.
Go. So I also took a long time, but it was not because I double majored. It was because I switched schools. I was going for communications, and then I was in Florida and decided I really didn't want to do that. So I came back to Rhode Island and switched to nutrition. So that took me 5 years, and then I took a year off to travel. I really didn't know what I wanted to do or where I wanted to be. So I traveled for a year, and then I came back and got my master's and was a teaching assistant at URI. And then I still didn't feel ready to do the internship. So I went back to waitressing. I had waitressed on and off throughout college, and I waitressed, and like I was also a diet tech at Hasbro. And so I kind of just combined those things. And then I did my internship. And throughout the internship, I really liked the clinical aspect. I liked being in a hospital. I liked the people that I worked with there. I liked the environment. And so I knew that I wanted to start there. And there were also at the time a lot of available positions for clinical work. I don't know what that's like now, but it was not difficult for me to find a position there. Um, but I also have always done a lot of different things at the same time. I still sometimes pick up shifts waitressing because I like it. While I worked in the hospital, I worked at private practices. So I am the kind of person that like I don't really like doing one thing full time. I like to kind of do different things. I still, even now, will teach some classes at yoga studios or um, different things like that, just to mix it up. And because I work from home, so I do like to see people and be around groups of people too. So just kind of having variety has really worked for me.
That sounds great. Thank you.
Mhm.
Yeah, I agree with everything everyone has said so far, echo all of that. And I just think that like you are all, I'm assuming, getting the same degree, or most of you are getting the same degree, but what you get out of it will be so different from person to person. So really just taking agency in your education and getting what you want out of it, because you're here for you and no one else. And so if you aren't thinking you want to go down the path of, I don't know, clinical, and that seems what everyone's doing, then you don't have to do that. And you can get whatever experience you want and focus that you want by reaching out to dietitians in different fields and seeing what they do for jobs and seeing if they like it and what a normal day looks like. And I think for me, I had similar to everyone else, I kind of had no idea what I wanted to do. So when I graduated, I was so lost. So I think that just like trial and error really worked for me. I did a million different things, and I thought I wanted to be like an assistant professor, really research focused. I did a PhD because I thought I wanted to do that. By the end of the PhD, I was like, I'm a little sick of this research stuff. So, kind of then doing an internship, and then just finding out what works and what doesn't work, and really just getting clear on what you want your life to look like, what you want out of your job. I think it is the most helpful thing that I did, and trying to decide a career path.
Thank you. Kristen, do we have any questions in the chat that you feel you want to ask now before I
We
continue?
do not yet.
Not yet. Okay. Well, I'm going to ask, I mean, you guys have talked about this a little bit, as far as, some of it being a lot on the computer and administrative and maybe not doing as much research, but what percentage of your work now do you feel involves, direct client or patient interaction versus, research, or the amount of documentation, you have to do, or just administrative tasks? How do you feel that that's kind of divided up now?
I can start again. One of the beautiful things about the practice where Jackie and I work is they now have AI scribes. So we, like, charting wise, note taking wise, we still have to do notes, of course, but we do have an AI scribe that essentially writes the bulk of the note for us. And then all that we have to do is go back in and like read it, make sure it's accurate, tweak some things, and then sign the note. So that is definitely one of the things that drew me to this practice, because I was like, amazing. That's one of, I think, something that in like a more clinical setting that you hear about a lot probably is like, oh, the charting, and like Nicolette was saying, just so much time spent on a computer and doing the notes and all of that. So it really allows you to be, when I'm in with the patients, it's more of a conversation rather than me being on the computer typing while they're talking. It's a full conversation. I'm fully looking at them. It doesn't feel like my attention is being drawn to the computer. So I guess, you know, AI has its things, but one of the positives is in this setting, we're able to use it so that we can have more of a connection with the patient. And then in terms of day to day, my day is basically spent all day just counseling, talking to people, squeezing in the notes in between. Of course, there's cancellations and no-shows. And so then we're able to use that chunk of time to get some other paperwork done, emails, other like creating handouts, assignment things that we have outside of seeing patients. But generally speaking, most of our time is spent just with patients. It's a flexible schedule. We get to make our own schedule. So a lot of flexibility within the job.
It sounds like a real positive, being able to
Yeah.
spend more time with patients and less documentation. How new is the AI scribe?
I think so. They had it when I started the practice. I think it's pretty new though. I don't know, Jackie, if you know exactly. I think it's like a year or two that they started using it. So still relatively new because other dietitians here still say like, oh my God, I can't believe how amazing it is not having to do the charting. So Jackie and I snuck in at the right time.
Yeah. Yeah, we're spoiled for sure.
Yeah.
I can go. I would say I probably spend about 80% of my time with patients. The rest of it, I would say, so I actually still do my charts. I type, but I do all telehealth visits. And so I do a split screen, and I don't find it to be distracting. I just type things while we're chatting. And then I will tweak it afterwards a little bit. And then other than that, I do my own billing, which honestly takes me like maybe 20 seconds per client. I thought it was going to be this enormous, cumbersome thing. And initially, I actually looked into hiring a biller when I was first starting my business, because I was like, there's no way I can learn this. I don't know how to do it. And I think it was like 8% or something they take. And I was like, no, like I don't really have a business yet. I'm not going to pay for somebody to do this for me. So I took a couple of classes and just learned how to do it myself. And it really doesn't take me any time at all. Sometimes I have to call the insurances, but for the most part, I have my clients check on their own benefits, and that's their responsibility. So I don't do that for them. And that has saved me a lot of time. And then other than that, I do some marketing. I visit some doctor's offices, but most of my time is with the clients for sure.
That's fantastic to hear. 80% patient time when you're doing your own billing. I think that's very encouraging.
Yeah. It was surprising to me too, honestly.
Fantastic. Who wants to go next?
I can go next. My job's very different. I would say I probably spend like 5% of my time working with community members or patients one-to-one. It's a little different overseeing and managing federal funding and a large public health programs focused on a specific chronic disease, but that's what I wanted out of my career. So it's really interesting to be in my role. It's a little bit prescriptive. What we're focused on for diabetes and cardiovascular health stems from the funding that we receive, and the bulk of our funding comes from the CDC for the prevention and management of diabetes and cardiovascular health programs. So I oversee a program that has 7 public health professionals, and we have numerous contracts with partners and healthcare and the community. And I do my best to get out, meet with our partners directly, meet with members of the community directly, but we're charged from our grants on scaling and sustaining the delivery of evidence-based lifestyle change programs like the National Diabetes Prevention Program and Healthy Heart Ambassadors. We work with partners in the clinic space to prevent diabetes complications through early detection. So we work with clinics to increase their screening and early detection of chronic kidney disease and diabetic retinopathy. We also work to expand and strengthen the community health worker workforce for chronic disease prevention and management. And then we also have a number of contracts with clinic partners to enhance and strengthen their electronic health records for better population health management, team-based care, and clinical community linkages. So it's different work. It's systems level work, which I really like. And but going back to the administrative components, yes, most of my job is a lot of administrative tasks like contract management, grant writing, grant reporting, but I also really enjoy that. So it's just a different perspective. I feel like I reach a lot of people and serve the state at large in my role, which is definitely what I wanted out of my RD career.
That's fantastic. It's great to see the different opportunities out there also. So thank you for sharing that. That sounds really, really interesting.
Yeah, thanks.
Yeah, and same as Kyla, for me, we've spent probably like 95% of our day face-to-face with patients, so it's a lot of talking. But just quickly, when I worked as a campus dietitian, probably only about like 15-20% of my job was meeting with students face-to-face. The rest was doing a lot of back-end stuff. So you kind of get like different things out of different jobs depending on what you like and what kind of person you are. But that was kind of one of the reasons I didn't enjoy it as much, was because I really wanted to be working face-to-face with students. And I know that's not everyone's jam, but that was what I wanted to get out of it.
Yeah, that really, that was great to hear, everybody. And there are such, different opportunities. If you want to be, over 80% with patients, there's those opportunities. And if you're more, want to do more research and administrative tasks, then you can have a lot less time with patients. So this is fantastic to see the different opportunities and different things you are all doing. Do you think there's any specific skills, experience, or even certifications that can make students more competitive for these types of positions in the field you're in or your organization, things you could suggest for students, to start thinking about doing now to make them more competitive?
I think just, oh, sorry, was I interrupting?
No, I was going to say, were you going to say something?
I just going back to taking your time. I think that the time that you take and the opportunities that you seek give you experiences that you can put on your resume, which is always really helpful. So there are some positives to taking your time and gaining some experience that helps you to solidify what you want out of your RD career, and that experience that you gain is always helpful on your resume. But I think just overall communication skills, written and oral, anything that would give you strength, that would strengthen your skills and your experience from that sense, has always been really helpful to me. I mean, I say that knowing that most of my job is administrative tasks, so a lot of grant writing, grant reporting, but I also have to be able to speak clearly and articulate clearly to partners, and that is really critical in my role. And I would imagine those communication skills are key for some other RDs who are on this same panel with me.
Definitely agree, of course, with all of that. I also think when I think about kind of how the opportunities in my career so far have played out, networking is super important, and maybe not in like the traditional sense, like you might not realize you're networking. So just like not burning bridges and always keeping in mind that strengthening those relationships, whether it's somebody you're interning for, whether it's someone you had like a 30-minute conversation with. If you can get to know people and kind of pick their brains, you never, especially in Rhode Island, you never know when they're gonna pop up again, or when an opportunity with them maybe will present itself. So again, I think if you see somebody and what they're doing interests you, reaching out and even just establishing a relationship, maybe it's just over email, so they know your name and they recognize your name, so that if 2 years later you're applying for a job where they're working, they might see your name and be like, oh, I remember they emailed me and had a great question, or whatever it may be. Presentations sometimes, like if I remember in my internship, we would always have you know, people presenting to us, things like that. Maybe sending them a quick email after the presentation being like, it was so great to hear from you. I loved, you know, you shared X, Y, and Z. Again, just kind of getting your name out there so that people recognize it, so that when it comes time to applying to jobs, internships, whatever it is, you already have a little bit of a network established.
Yeah, and just going off that quickly too, remembering that, especially if you do want to stay in Rhode Island, like Kyla said, it's such a small world of dietitians. So when you are in your internship, or even when you are taking classes and meeting all these different professors, know that you are networking whether you want to or not. And you're kind of like putting your impression of yourself out there, whether you know it or not, too, just by sitting in class, just by answering questions, just by, you know, showing up to work. So even if you don't think like, oh, I'm networking or I'm trying to make these connections with people, you are. And so trying to put always like your best foot forward and be your best self, and just know that, you know, people aren't always judging you, but they do remember, in this dietetics world being so small, pretty much everyone that comes through the door. So just knowing that too.
I agree with all of that. So when I was switching to insurance, I had actually reached out to a local dietitian that I had met in a previous year. I can't remember how I met her, but she owned her own practice. And I asked her if I could just shadow her for a day to see how she does her insurance. And she was more than happy to show me how she does her billing and give me tips. And that like made a huge difference for me. So I do think the networking, and like I am happy to like I've helped other dietitians at this point start their private practice. So I think having people that you can reach out to is really helpful.
I think that's great advice. Communication, networking is so important. How has the increase in personalized nutrition apps changed what dietitians do compared to a few years ago? Have you noticed a difference with that? You can all answer that, or especially those with counseling. How has that changed?
I was just gonna say, I think it's tough because what I find is there's so much out there. Sometimes, I mean, with counseling, it's so individualized that these apps, I mean, I'm not like huge into social media, so there might be a lot more that I'm only aware of like what my patients have kind of brought up in our sessions. So I'm sure there are so many more that exist than what I'm even aware of. But I do kind of feel like every day someone's bringing up this new like tracking app, or, oh, have you heard of this? Or, oh, and some of them are really beneficial in the sense of like there are some symptom trackers or food journal apps or things that can be helpful in that sense. But I do find that, you know, it can be a slippery slope with what nutrition information is out there and where people are getting their information from. And you hope that the intent of a lot of these apps are that, you know, they've been well researched and people are hopefully making them from wanting to help people, but also unfortunately, like the marketing world of things is not always that way. And so I do find a lot of times having conversations with people, and it comes down to, you know, maybe an app is helpful in certain circumstances, but can we bring it back to like learning about your body and trusting your body, and can you make decisions for yourself, not having to rely on an app or what the app is telling you, and things like that. So I think it's kind of a nuanced, complicated conversation, but I'm sure there also are a lot more apps out there that exist that I'm just not aware of.
Are
I
there,
think,
oh, go ahead.
I was gonna say, I think for me too, I've noticed a big piece of what people are missing in healthcare is that connection and feeling like heard and validated. And you don't get that from an app. So actually, like a lot of my clients maybe have tried things like that and then will come to me looking for me to listen to them and help them. I think a lot of times also patients don't really know what they need. They think they do, but like through discussions and like our opinions, like our educated opinions, help them form what they really need and like help them work through that as opposed to like a more generic app or something like that.
Does anyone else have anything to add to? Jackie, do you see patients using those also?
Yeah, I do. I feel like the bigger thing is more just like other forms of social media, just like TikTok and Instagram, and kind of a big part of the job is just kind of dispelling a lot of myths that are on, TikTok and Instagram and things that people see and these foods that are supposed to be really good or really bad. And so it's just like a lot of dispelling those. But yeah, I think they, like Nicolette was saying, a lot of it is like, I tried this and it didn't work. So like now I'm here. It's more of that type of thing.
That's interesting. I was thinking of apps that people put a lot of their foods into, like the MyFitnessPal, Chronometer, and you bring up TikTok and, a lot of things that they can watch in videos for the good and bad. Megan, do you see this at all or hear about this at all in the programs that?
Not so much the apps. I feel like what's kind of a big trend in terms of what I see now is lifestyle change versus medication management. So the GLP-1s have, kind of emerged as something that, could address the obesity epidemic and could play a part alongside some of the evidence-based lifestyle change programs that we promote. So trying to navigate some of these, newer medications alongside lifestyle change programs that we promote and deliver out in the community is something that we're looking into and following.
That's interesting too, especially in the area that you're working.
Yeah, that seems to be a really big interest of the public. But that's not, a lot of people are looking for a quick fix or something that could, yeah, so I understand that.
Well, thank you all. I see we have about 5 minutes, so I want to go back to Kristen to see if there's any. I was going to leave 5 to 10 minutes at the end for questions. Kristen, do we have any questions in the chat, or do you want to open that to others to ask?
We have one in the chat that says, if you could take a gap year between undergrad and grad, is there something you wish you'd done to help make post-undergrad life easier? Any thoughts?
Yeah, I did take a little gap. I took I graduated in December. It was late. So I took like a semester and then a summer off and then started grad school in the following fall. So I did take that time off, and honestly, I knew the rest of my next few years were going to be crazy and just a lot of newness. So I really took that time to just kind of relax a little bit and kind of get again clear on what I wanted to do. And one of the biggest things that was important to me was just making as much money as possible that I could before I went back to school. So there wasn't anything that I did to further my development academically or for my career. I'm sure there are things that I could have done, but the number one for me was I need to be able to pay my rent for a whole 2 more years of school. So how can I make as much money as possible? So I just served for day and night for the whole summer, and that's just what worked out for me.
I would agree. I think I similarly, I guess, between my master's and internship had a similar situation. I had about a year and a half just in the nature of the timing that my master's ended when the die-cast match was, which I don't think is a thing anymore. So I don't know if that would apply, but it's like you had to wait till the spring to do the match. So there was like an awkward amount of time. And then my program didn't start until my internship didn't start until the following January. So the way it played out, I had about a year and a half in between. And unfortunately, or fortunately, I guess, and unfortunately, similar to Jackie, it was kind of like, I just need to work 3 jobs and save up to be able to afford to live on the Cape for 9 months while I do my internship. And I think that's the nature of this process that a lot of people don't understand until you're in it is, it can be, you have to make it work. And that looks different person to person, depending on, what you have access to, what jobs you're working, things like that. And so I think when I think back to, even 6 months ago, I guess if I could give advice to anybody who is coming out of the internship and maybe done with school and going into a job, if you have the opportunity to give yourself a little break in between, I think I like finished internship in September, took my exam in October and started work in November. So I just was like, didn't even come up for air. I think because I just felt kind of like I just have to start working and just one thing after another. And now being maybe 5 or 6 months into it, I wish that I had between exam and starting work, maybe given myself a month or 2 to just like breathe and kind of relish and like finally being done with school before getting into the next steps of starting a new job. In hindsight's 2020. So, if I had done that, maybe I would have been like, I wish I just went right into work. But I think giving yourself a second to kind of breathe and celebrate, like, wow, you've worked really hard for this long before always rushing into the next step, can be beneficial.
I took about a year off. So after I graduated undergrad, I moved back home and worked as a server and saved up a ton of money. And then I traveled for 5 months and honestly didn't think about school or nutrition at all, which is maybe not the right decision for everybody, but that was where I was at. And then I came back and I started applying immediately for grad school. And then I stayed home. I stayed living at home for a little bit while I was also working and saving up money. So I think everybody's journey does look so different and you just kind of have to figure that out for yourself. But I don't think there's like a right or a wrong answer.
And Megan, do you have anything to share?
Yeah, no, I agree. I'm jealous of Nicolette. I wish I wish my little hiatus was for travel, but when I was finishing up my master's degree at URI, I was applying for dietetic internships and through the die-cast match system. And because I already had a master's degree, the internship that I matched with had just the dietetic internship only track that started in January. So when I graduated with my master's degree in May, I had, from May till January to just work, save up as much as I could so I could really enjoy my dietetic internship process without working as much. But I waitressed throughout undergrad, graduate school. I had a research and a teaching assistantship at URI. And then in the summer months, I would work for SNAP Ed. So yeah, my little breaks were always working. So but I mean, it all worked out. It's all good experience. So yeah, but very jealous. I wish I could have traveled during that time. But I guess, well, anyway, yeah.
Well, I think that's true. It is very different for everyone. And hopefully, if we don't get to travel at that time later on in life,
Yeah.
we make up for the travel later, right? So,
Mhm.
well, thank you all so much. I'm going to let Kristen, I think we're out of time. Kristen and I don't know if there were any questions left in there or.
I think you covered everything. I appreciate you adding in your questions, and I think it made it really personal and really informational, educational for the students. I know that Robin just put in there that she thought this was excellent, great panelist answers and all of the things. I know that she has about 17 students in class. So we're able to reach quite a few today. With that, I think I'm going to stop recording, but I appreciate all of you for being here. I know some of you have come back a couple of times, so thank you for always saying yes. Kim, thank you for stepping in. Really appreciate it. With that, we'll stop recording.